We always get asked, what's your ideal patient? We're gonna have a full throttle conversation about that. Hey, doc audience, the perfect patient. Who is that? What are they like? Rod, we see a lot of patients. We get asked this all the time, right? What's your perfect patient? I think it's probably a pretty complicated discussion, but what do you think?
Yeah, I mean, like, who is your perfect doctor?
Yeah.
Nobody's perfect. But, for us, a perfect patient is someone who's reasonable, rational, listens to us, and is certainly somebody that works with you on the outcome, because plastic surgery is surgery. So sometimes you get great results, sometimes the results aren't perfect, but someone that actually is just a nice person that's reasonable. I think those are the best patients.
Yeah, it's funny because when you're seeing patients, sometimes when I talk to my friends that are lay people, they're like, oh, I bet you it drives you crazy when the patient's asking you a bunch of questions. And that's a loaded question because sometimes that's true. But I actually like it when somebody obviously has done proper research and they've got good questions.
Right.
It's great because that means they're engaged. They're going to be a good patient. Engaged patient always does better.
I agree, and they're smart, they know the right answers to ask about, real surgery, and they've talked to their friends, and yeah, they've been to your website, not the Google website. I saw two patients today one was from out of the country and one was from the US, and I knew in 5 minutes or less that I'm never gonna operate on them because you don't connect.
Right.
If I don't connect, it's also, I always tell people, I don't operate on people that smoke, that are not healthy, and I don't like.
Yep.
If I don't connect or like the patient, I'm not going to operate on them.
Right.
Because, it's a long-term relationship.
That dynamic is a really interesting one, but it's critical. And so there's probably lots of people that could be an ideal patient, but those are some kind of key points that are characteristics of people that can be an ideal patient.
I agree, and also, in plastic surgery, especially cosmetic surgery, you're taking somebody who's normal and improving on them. So it's a lot different than, you've got a hole in your face or we're gonna do a breast reconstruction. It's a different type of interplay of how you deal with these patients because you're really trying to improve on who they are.
The door swings both ways too. It's so great when you see a patient and you can tell when you connect with somebody because
right.
You got some sort of common interest or it's easy to kind of discuss things that you say something and the way you say things and they get it and they say it and you get it. That connection is critical.
You can really find that out in couple of minutes or less.
You're gonna like this video on unforgettable moments, extreme cases in patient care.